Hi, I'm Michelle Reuben, a licensed professional counselor and the clinical director of dialectical behavior therapy for Penn Medicine Princeton Health Behavioral Health. Today, I'm going to talk about trauma and its connection to addiction in women. Recognizing the connection between trauma and addiction can mark the first step in a woman overcoming both the traumatic experience and substance addiction. It is important to realize that trauma is a very personal and unique experience. How it affects one person may be different from how it affects another. Emotional and psychological trauma are the result of extraordinarily stressful events that shatter your sense of security and make you feel helpless. Traumatic experiences can leave you struggling with upsetting emotions, memories, and anxiety that won't go away. It can also leave you feeling numb, disconnected, and unable to trust other people. Traumatic experiences often involve a threat to life or safety, but any situation that leaves you feeling overwhelmed and isolated can result in trauma, even if it doesn't involve physical harm. Trauma can be caused by a one-time event, such as an accident, injury, or a violent attack, especially if it was unexpected or happened in childhood. It can also be caused by ongoing stress, such as living in a crime-ridden neighborhood, battling a life-threatening illness, experiencing traumatic events that occur repeatedly, such as bullying, domestic violence, or childhood neglect. There are commonly overlooked causes of trauma as well, such as the sudden death of someone close, the breakup of a significant relationship, or an experience that left you feeling humiliated. The circumstances that are experienced aren't what determines whether an event is traumatic. Trauma is unique to each person, and your emotional experience of an event or situation determines how you respond. The more frightened and helpless you feel, the more likely you are to be traumatized. After a traumatic experience, it's normal to have upsetting memories, feel on edge, or have trouble sleeping. Some people may also have trouble performing daily activities such as going to work or school or spending time with family and friends. While most people start to feel better after a few weeks or months, long-term reactions to trauma can include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like nausea or headache. There is no question that trauma and addiction are tied together for both men and women. However, research has shown that men tend to abuse drugs or alcohol to avoid problems, feel empowered, or to fit into social situations, while women turn to substance use to cope with psychological or emotional issues. In fact, according to the National Institute on Drug Abuse, studies show that 15.4% of women ages 18 or older have used illicit drugs in the past year. Some of the reasons women turn to drugs or alcohol as a form of self-medication include stressors in relationships or pressure from a boyfriend or spouse, experiencing childhood trauma, parental drug use or an unstable home environment as a child, victimization from trauma or abuse, co-occurring disorders like anxiety or depression, eating disorders or an attempt at weight loss. It is also important to note that there are a variety of personal and interpersonal issues that women are more likely than men to experience. First, women tend to face more of a stigma in addiction than men. Women who are dealing with addiction issues also face a higher level of violence and abuse, tend to have more difficulty recognizing their substance abuse for what it truly is, are more likely than men to have experienced some form of childhood trauma, aren't asked about their drug or alcohol use by professionals as often as men. One of the major consequences associated with gender and addiction is that women are less likely to seek out or receive addiction treatment. The women's program at Princeton Health helps women understand the connection between trauma and addiction. Women in the program focus on building self-esteem, understanding the link between trauma and addiction, achieving abstinence and/or reducing the negative consequences and health risks associated with substance use, learning ways to cope with emotions and build healthy relationships. In the program, women also learn to recognize their trauma and triggers and replace unhealthy coping skills with healthy ones. With support from therapists, fellow group members, and loved ones, the program teaches women how to feel safe within themselves and navigate their world in a healthier way.